Yesterday, as everyone knows, we received our first shipment of the COVID-19 vaccine at 8:10 a.m. yesterday. We also had our first vaccination in the afternoon. And so, Dr. Romero, thanks to your team for some very quick action in getting that out. And I was pleased that Cherie Ann Kwanizai was the first Arkansan to receive the vaccine. And we appreciate her support and her setting that good example for all of Arkansas. On Friday, and I get this question often, when's the next round coming in? On Friday, I expect to receive notice as to the next shipment on the Pfizer vaccine, and that should indicate how many doses and the timeline for receipt of that vaccine. And that should be a recurring process that every Friday we'll get notice as to what the shipment will be the next week. And Dr. Romero will have additional comments on the FDA process in the future. Our goal is to get our healthcare workers, our emergency responders, and the staff and residents of our long-term care facilities vaccinated as soon as possible. And then we'll move to additional priorities and on to the general public. And everyone wants to know the answer to the question, when will it get to me in terms of priorities? We know exactly where we are in terms of the first set of distribution, and there'll be more decisions made as to how this flows into the future until it gets to the entire public. This is a massive distribution effort. It's a lot of logistics. It worked well yesterday, but we have to make it work every day well, and we will get there. Those CDC guidelines and recommendations to the states are very important. We followed their early recommendations, and of course Dr. Romero's engagement of that makes a difference as well. But I would add that Dr. Romero and I will look at what their recommendations are, and then we will tailor-make them fit for Arkansas if there's any special needs or adjustments that need to be made in our state. And so we likely will be following the guidelines, but it is a recommendation, and the states can tailor-make that as needed, and we will look at that in the coming probably 10 days. Next question.
Governor Mike McNeil at MagnoliaReporter.com. By when might we expect there to be enough vaccines available in Arkansas for delivery to everyone who wants one?
Well, one, we don't know precisely the date of that because it depends upon the production capacity of Operation Warp Speed and the pharmaceutical companies. It also perhaps depends upon how many vaccines the FDA is able to approve, because we have Moderna that's coming up this week. It very well could be Johnson & Johnson or another one down the road. And so that precise date is not known. I have a lot of confidence in our manufacturing capacity and the safety of it, so I am hopeful that by late spring, this will be widely available to everyone in Arkansas.